Alright, so at the beginning of my shift, I would verify my order, make sure the medications are appropriate. And then I would go into the med room and I would verify, okay, I have a lot of fallings here. She has some allergies, Tigamin and codeine, and I would make sure in the drug book that none of the medications had that would cause an interaction. So our first med is digoxin that we need, is due at 0900, and the time now will be 0900, so it's appropriate to give digoxin. So I would go ahead and go in the med room in the Pyxis, and I would pull out a digoxin. So here we have available 0.25 milligram tab, and I did the calculation, so it would come out to 1 tab to equal out 250 micrograms, microgram, and it's not expired. So I would go ahead and put that in the med cup. Potassium chloride is due at 1200, so I will not pull that. The next one's famotidine, and it's 20 milligrams IV BID at 0900, and that's appropriate to pull out. So I would go ahead and go in the Pyxis. So we have famotidine 20 milligrams IV BID, and here we have famotidine 20 milligrams per 2 mLs, and it's not expired. So we'll go ahead and put that to the side. So the next one is Procti regular insulin, 6 units subcutaneous, due at 0900, so that's appropriate to grab. So here I have regular insulin, 100 units per ml, and it is not expired. So go ahead and grab that. All right, so for digoxin, I would make sure her potassium is not less than 3.5, otherwise I would hold, and I would also hold if her apical pulse was less than 60. So for famotidine, 20 milligrams, I made sure to look in the book. It says to push the rate of administration is 20 milligrams per 2 minutes, and to dilute between 5 to 10 mLs of normal saline. So I would go ahead and dilute it in 8 mLs of normal saline, and giving the 2 mLs per med, and the rate of administration would be 10 mLs over 2 minutes, 5 mLs over 1 minute, and 2.5 mLs over 30 seconds. So I would go ahead and set that up. So I would go ahead and discard, and I would have 8 mLs of normal saline. And I would go ahead and grab my needle and syringe to pull it out of the vial. So I would go ahead and connect that, and I would go ahead and save these for later on when I flush the IVs. I would go ahead and scrub the hub for 30 seconds. Time has elapsed. All right, now we'll go ahead and fill it with 2 mLs of air. Now we'll carefully inject that air and grab the medication. All right, and I would safely recap the needle, discard for facility policy. So here we have 2 mLs. There we go, 2 mLs. And, oh, I still need to inject it into my normal saline. And then I would inject. And then discard for facility policy. And I would have 10 mLs. 10 mLs, and I will go ahead and label against the vial. So we have famotidine, and it's 20 milligrams per 2 mLs, and it's not expired, so 10/29. I'll go ahead and hold that to the side, and I would need to flush it with 2 IVs. And then, so I would discard that for facility policy. Next is our insulin. So I would grab our insulin needle. And here I would scrub the hub for 30 seconds. Over 30 seconds, time has elapsed. And then here I would pull down 6 units of air and insert and pull out 6 units of insulin. Now let's safely recap. And I could show you, verify with another nurse, 6 units. And then I would go ahead and label according to the vial. And it's not expired. Okay. Alright, so my medications are ready. And I would go ahead and put this back in the Pyxis. So I have my alcohol swab. Now I'll go ahead and go to the nurse's station for my second check. So I'm at the nurse's station doing my second check. So I have a lot of fallings here. She has allergies to Tagamet and codeine. So the first medication is digoxin, 250 micrograms. And here we have digoxin 0.25 milligram tab. It is not expired, so it comes out to 1 tab for 250 micrograms. The second one is famotidine, 20 milligram IV. And here we have famotidine, and it's 20 milligrams per 2 mLs, and it was diluted in 8 mLs of normal saline, and it is not expired. The third check is regular insulin. We need 6 units, and here we have regular insulin, 6 units, and it is not expired. So I would go ahead and go into the patient's room. So, knock knock. Hi, Miss Lotta Fallings. My name is Selena. I'll be your student nurse today. So I would provide privacy, wash my hands, put on gloves. Are you able to tell me your first and last name? Lotta Fallings. Good. Can you tell me your name and your date of birth? 10/5/26. Good. 10/5/26. And I see you have an allergy band. Do you have any allergies? Tagamet and codeine. Okay. We don't have any medications with Tagamet and codeine. So you're all set. I'm just gonna go ahead and do my third check for safety measures. So our first medication is digoxin, which is 250 micrograms. And here we have digoxin, that's 0.25 milligrams. And it is not expired. And I made sure that your potassium's above 3.5 or otherwise I would hold. And I would make sure your apical pulse is greater than 60. If not, I would hold. You have famotidine here, and it's 20 milligrams. We have famotidine here, and it's 20 milligrams per 2 mLs, and it's diluted in 8 mLs of normal saline, and it's not expired. The last one is regular insulin. So here we have regular insulin, 6 units. Here we have regular insulin, 6 units, and it's not expired, and I would make sure your glucose is greater than 110, or else I will hold. All right, that's a lot of fallings. So I have 3 medications here to give you. The first one is digoxin. It's an antiarrhythmic. It's to help with your AFib. Some side effects are headaches, nausea, vomiting. Let me know if you do get those, because that could lead to digitoxicity. The next one is famotidine. It's to help with the stress peptic ulcers while you're here in the hospital. Some side effects can be nausea, diarrhea, confusion, dizziness. And then the last one is regular insulin here. It's a hormone. It's to help with stable out your blood sugars. Some side effects can be headache, hunger, irritability. Are you okay with taking these medications? Okay. So first one is digoxin. I'm going to make sure to check your apical pulse. Make sure it's not less than 60. So I'm going to go ahead. Okay, it is not less than 60. So I would go ahead and to give it, your potassium's not low. So I would go ahead, I would have gloves, pour it in the cup, drink it, okay. And the next one is famotidine. So I gotta make sure your IV is still good. Do you have any redness? I don't see any redness, no swelling. Does it hurt? No? Okay. So I would go ahead, scrub the hub for 30 seconds. Against my watch. Time has elapsed. Okay, I'm gonna go ahead and flush the IV, make sure it's patent. All right, does it hurt? No? Okay. And I did 5 mL. So I'll go ahead and give famotidine. And I will go ahead and do 2.5 mL per 30 seconds, 5 mL, technically 5 mL per minute, and the whole 20 milligrams per 2 minutes. All right, time has elapsed. And then I would go ahead and flush at the same rate, which would be 5 mL per minute. So, okay, I would flush 5 mL per minute. All right, time has elapsed. And then our last one is our insulin. So this one, where's the last place you had it? In the back of the arm? Okay, we're gonna do it on the right lower quadrant of your belly. So I would go ahead and use perm and scrub for 30 seconds, disinfect. And then I will go ahead and give the 6 units, insert, good. All right, and I would dispose of per facility policy. All right, Miss Lotto Fallings, if you need anything, let me know, okay? Let me know if you do feel nausea, diarrhea. Let the doctor know. All right, so I would dispose of per facility policy, remove my gloves, wash my hands, put the bed down. Now I'm gonna go ahead and document. So here I'm gonna document that I did give digoxin. I gave it at 0900, so I would cross that out. And then I did give famotidine, and I did give regular insulin in the right lower abdomen. And I would sign CCSN and initial.